It's 8 a.m. on a Tuesday morning. Margaret, a 68-year-old retired teacher, is sitting at her kitchen table with a cup of coffee that's getting cold. In her trembling hands is a letter from her insurance company. The letter says, "Your Medicare Advantage plan is terminating effective December 31st, 2025. Margaret's hands shake. Her heart races. She's thinking, what does this mean? Will I lose my coverage? Will I have to pay thousands of dollars out of pocket? Do I have any options? What am I supposed to do? For the next 15 minutes, I'm going to show you exactly what this letter means. More importantly, I'm going to show you the hidden federal rights you have, rights that could save you thousands of dollars. But here's the critical part. Most seniors don't know about these rights, and they miss the deadline to use them. By the end of this video, you'll understand the exact steps to protect yourself, and you'll learn the one mistake that could cost you your benefits forever. Hi, I'm Jocelyn. I'm a senior policy analyst and retirement finance expert. For the past 15 years, I've been helping retirees and seniors understand the complicated rules that affect their Medicare, Social Security, pensions, and insurance. And I want you to know something important. What you're feeling right now, that panic, that confusion, it's completely normal. You're not alone. Over the past 2 weeks, I've received hundreds of messages from seniors who received these exact letters. But here's what I want you to understand. You are not helpless. You have federal rights, and you have time. In this video, I'm going to break down 1. What this letter actually means under federal law. 2. The powerful legal protections you have that most seniors never hear about. 3. The exact action plan you need to follow and the critical deadline you cannot miss. But before we go any further, I need you to stay with me until the very end, because there is a hidden mistake that thousands of seniors are making right now. This one mistake can permanently cost you thousands of dollars in lost benefits and increased insurance premiums, and I'm going to tell you exactly what it is. Let me tell you about Margaret's story, and then I'll tell you about what she did wrong and how to avoid her mistake. Margaret is a 68-year-old retired school teacher. She's been on Medicare for 3 years. She chose a Medicare Advantage plan because it offered wonderful benefits. Dental coverage worth $1,500 a year, vision coverage worth $200 a year, hearing aids coverage worth $1,000, a free gym membership, and even free rides to her doctor's appointments. It was perfect for her. Her out-of-pocket costs were capped at $250 a year. She felt secure. Then, in October 2025, Margaret received a letter. Her Medicare Advantage plan was being discontinued. The insurance company was pulling out of her state. Margaret did what most seniors do. She panicked. She called her insurance company. They said, "Don't worry, you'll be automatically moved to Original Medicare on January 1st. So Margaret thought everything would be okay. She did nothing. Here's what happened on January 1st, 2026. First, Margaret was reassigned to Original Medicare, Part A and Part B. That part was true. But she was not automatically enrolled in a Part D prescription drug plan. Margaret takes 4 medications for her heart condition, high blood pressure, and diabetes. Without Part D coverage, those medications cost her $385 per month out of pocket. That's $4,120 a year she wasn't expecting to pay. Second, Original Medicare doesn't cover the things her MA plan covered. No more dental, no more vision, no more hearing aids, no more gym membership, no more rides to the doctor. That's $2,000 to $3,000 a year in lost benefits. Third, here's the worst part. Original Medicare doesn't have an out-of-pocket cap. It's 20% co-insurance on everything. Margaret had a health issue in February. She ended up spending $3,000 out of pocket for medical services. Under her MA plan, she would have paid maybe $500. Fourth, finally, Margaret realized she needed a Medigap policy to protect herself. So she called an insurance company to buy Medigap coverage. But here's where her real mistake became clear. She had missed the deadline. When you lose a Medicare Advantage plan, you have exactly 63 days to apply for Medigap with what's called guaranteed issue rights. This means the insurance company cannot deny you. They cannot charge you more because of your health problems. They cannot exclude pre-existing conditions. Margaret missed that deadline by 3 weeks. When she called for Medigap coverage, the insurance company said, "We'd be happy to help you, but first we need to review your health history." Margaret had diabetes and heart disease. The insurance company denied her application. She could not get Medigap coverage. Now Margaret was stuck. She had original Medicare with 20% coinsurance. She had no prescription drug coverage. She had no Medigap backup, and she had no way to get Medigap because her deadline had passed. Over the next year, Margaret paid an additional $8,000 to $10,000 out of pocket compared to what she would have paid with her original MA plan. And here's the really sad part. This was completely preventable. Margaret had federal rights. She just didn't know about them, and she missed the deadline. This is why I'm making this video. Okay, let me break down exactly what the law says. And I want you to understand, this is not my opinion. This is federal law. This is what the government guarantees you. First, the 60-day notice requirement. When a Medicare Advantage plan decides to terminate, federal law requires them to give you written notice, at least 60 days before the plan ends. You should have received this letter in October 2025 or earlier. If you did, that's your signal that something is happening. Don't ignore it. Second, you will never have a coverage gap. This is important. Listen carefully. If your Medicare Advantage plan ends on December 31st, 2025, your coverage continues through that date. Your plan must pay all approved claims. You can use your doctors, you can use your hospital. Everything stays the same until December 31st. On January 1st, 2026, you are automatically reassigned to Original Medicare Part A and Part B. You will not be without health insurance. This is guaranteed by federal law. However, and this is critical, you may be without prescription drug coverage if you don't take action. That's the trap we'll talk about. Third, the Special Enrollment Period, SEP. When your Medicare Advantage plan terminates, the federal government gives you a special right. It's called a Special Enrollment Period, or SEP. Normally, you can only change your Medicare plans during one window, October 15th to December 7th each year. But if your plan is terminating, you get an extra enrollment window. You can change your coverage 60 days before your plan ends through 63 days after. Your plan ends, that's a 123-day window to make changes. In that window, you can 1. Switch to a different Medicare Advantage plan, 2. Switch to Original Medicare and buy Medigap if you want, 3. Enroll in a Part D prescription drug plan. All of this is outside the regular enrollment period, and there are no penalties for switching during this window. Fourth, guaranteed issue Medigap rights. This is the most powerful protection you have, and almost nobody knows about it. Here's what federal law says. In the case of an individual who has a Medicare Advantage plan and such plan is terminating or reducing its service area, the individual shall have the right to purchase a Medigap policy. Let me translate that legal language into English. If your Medicare Advantage plan is ending, you have a federal right to buy a Medigap, Medicare Supplement policy, and the insurance company cannot deny you coverage based on your health, charge you more because you have diabetes, heart disease, or cancer, exclude any pre-existing health conditions, make you wait to get coverage. This is called guaranteed issue. It means the insurance company must issue the policy to you, period. The time frame is critical. You can apply for this guaranteed issue, Medigap coverage, starting 60 days before your MA plan ends, through 63 days after your MA plan ends. If you apply during this window and you have a plan termination letter, the insurance company cannot use medical underwriting to deny you. But here's the critical part. If you miss this deadline, this right expires forever. If you apply for Medigap after the 63-day window closes, the insurance company can review your health. They can deny you, they can charge you more, they can impose waiting periods. This is not a maybe, this is permanent. Now let me talk about Part D. This is where most seniors are getting hurt. The Part D prescription drug problem. When your Medicare Advantage plan ends, you lose the prescription drug coverage that was bundled into that plan. If you do nothing, you will be assigned to Original Medicare Part A and Part B on January 1st, 2026. But you will not be automatically enrolled in Part D. If you go without Part D coverage for 63 days or more, you face a penalty. And here's how it works. The Part D late enrollment penalty. The penalty is 1% per month of the national base Part D premium. For each month, you are without creditable coverage. In 2026, the national base premium is about $34.50 per month, so 1% per month equals approximately $0.35 per month. If you go 12 months without Part D coverage, your penalty is I 12%, or about I 4.14 per month. And here's the critical part. This penalty lasts for the rest of your life. Every time you enroll in Part D, whether that's next year or 10 years from now, you will pay this penalty on top of your regular premium. What you need to do. You must enroll in a Part D drug plan by January 1st, 2026, or within 63 days after your MA plan ends. If you enroll during this window, there is no penalty. You're covered. The out-of-pocket cost difference. Let me show you why this matters. If you don't have Part D coverage and you go 12 months without it, a senior taking 4 medications, one for heart disease, one for high blood pressure, one for diabetes, one for cholesterol, can spend $300 to $500 per month out of pocket. That's $3,600 to $6,000 per year with no coverage. With Part D coverage, that same senior might spend $100 to $200 per month with deductibles and copays. That's $1,200 to $20,400 per year. The difference, $20,400 to $4,600 per year. Add in the lifetime Part D penalty, and you're looking at additional costs that will follow you forever. The Medigap and out-of-pocket cap issue. Here's another critical difference. Medicare Advantage plans have an out-of-pocket maximum. In 2026, it's $9,250 per year. Once you hit that limit, the plan pays 100% of everything. Original Medicare has no out-of-pocket cap. You pay 20% coinsurance on everything, forever, no matter how much you spend. If you have a serious health issue and rack up $100,000 in medical bills, you pay 20%, that's $20,000 out of pocket. That's why Medigap is so important. A good Medigap policy, typically Plan G or Plan N, will cap your costs at $200 to $400 per month. But you can only get this guaranteed issue Medigap without medical underwriting during your 63-day window. After that, good luck. The insurance company might deny you. The benefit loss reality. Let me be very specific about what you lose when you move from Medicare Advantage to Original Medicare. Dental coverage drops from $1,200 to $1,500 per year to $0 per year. Original Medicare doesn't cover dental. Vision coverage drops from $100 to $200 per year to $0 per year. Hearing aid coverage drops from $500 to $2,500 per year to $0 per year. OTC allowances. You had $100 to $200 per year for over-the-counter items. Now it's gone. Fitness and gym. Many plans covered gym memberships. Now you pay $30 to $50 per month privately. Transportation. Many seniors relied on covered rides to doctor appointments. Now it's gone. Seniors report losing $2,000 to $5,000 or more per year in these benefits alone. Add that to the out-of-pocket costs and the prescription drug costs, and you're looking at a massive financial hit if you're not careful. Okay, here's what you need to do. Right now, not next week, now. Step 1. Check your letter. Look for the official letter from your Medicare Advantage insurance company. It should say one of these things. Your Medicare Advantage plan is terminating. Your plan is not being renewed. You will be reassigned to Original Medicare. This letter will have a date. That date is your deadline reference point. What to do? Keep this letter. Don't throw it away. You will need it. Call your insurance company if you haven't received it yet. Ask them, is my plan being terminated? When does it end? Write down the date. Step 2, make 3 decisions by December 31st, 2025. Decision 1, what will your medical coverage be on January 1st, 2026? Option A, stay with Original Medicare, Part A and Part B, and buy Medigap. Option B, switch to a different Medicare Advantage plan. You have until December 7th, 2025 through the regular open enrollment, or through March 31, 2026 with your special enrollment period. Decision 2, will you have prescription drug coverage? You must enroll in Part D by January 1st, 2026 if you're switching to Original Medicare. Go to Medicare.gov or call 1-800-MEDICARE. You can compare Part D plans right now. The cost varies. Some plans are $0 to $50 per month premium. Find one that covers your medications. Decision. 3. Will you apply for Medigap? If you're switching to original Medicare, I strongly recommend applying for Medigap during your guaranteed issue window. Do this between now and March 31, 2026. Actually, do it by December 31 to be safe, so coverage starts January 1. Visit Medicare.gov, Medigap Supplemental Insurance Plans. It will show you which companies sell Medigap in your area. Call them for quotes. When you apply, tell them, I'm applying because my Medicare Advantage plan is terminating. I have a guaranteed issue right. Step 3. Call your state SHIP for free. HELP. SHIP stands for State Health Insurance Assistance Program. It's a federally funded program. It's completely free. They have trained counselors who will help you for free. Go to shiphelp.org. Enter your state. Get the phone number for your local SHIP office. Call them and say, my Medicare Advantage plan is terminating. I need help understanding my options. They will explain Medigap options. They will help you compare prices. They will help you apply for free. This is one of the greatest resources available to seniors, and most people don't even know it exists. Use it. Now let me tell you the hidden mistake that thousands of seniors are making right now. The mistake is thinking that silence equals safety. Seniors get their termination letter. They put it in a drawer. They think, well, the government said I'll be reassigned to original Medicare, so I don't need to do anything. This is wrong. You must take action. Here are the 3 things that will happen if you do nothing. 1. You will lose your prescription drug coverage. No Part D. When you finally realize this in February or March and try to enroll, you will owe a lifetime penalty. 2. You will not be able to get a Medigap policy without medical underwriting. Your health conditions will be used against you. You might be denied. You'll pay 20% coinsurance for the rest of your life. 3. You will lose thousands of dollars in dental, vision, hearing, and transportation benefits that your MA plan was providing. The solution: don't stay silent. Take action in the next 30 days. I want you to understand something important. You should not rely only on YouTube notifications for critical information about your Medicare and retirement benefits. Things change. Rules change. Deadlines come and go. That's why I created the Global Senior Alerts Official WhatsApp channel. This channel sends you real-time alerts about Social Security rule changes, Medicare coverage updates, pension and tax law changes, bank regulations affecting seniors, travel rules for seniors, insurance claim issues, and here's what you get for free: a complete senior benefits protection guide that includes exact step-by-step instructions for claiming benefits, deadline calendars for every major senior benefit, contact information for every government agency, how to appeal denied claims, how to protect yourself from scams. To join, click the link in the description below. It takes 10 seconds. Once you join the WhatsApp channel, you'll get the Senior Benefits Protection Guide downloaded directly to your phone. You'll also get real-time alerts when there's a change to Medicare, when Social Security announces a COLA, when new rules go into effect. You'll be notified before the misinformation spreads on Facebook. This is my promise to you. You will never be left confused about your benefits again. Final reminder, your deadline is March 31st, 2026 to apply for Medigap with guaranteed issue rights. Your deadline is January 1st, 2026 to enroll in Part D. Don't miss these deadlines. They change your life. If you found this video helpful, please like it, subscribe, share it with other seniors who need to see this, and join the WhatsApp channel. That's where the real community is. That's where you'll get alerts and support. You've got this, and I'm here to help.